But as caregivers, have you had your COVID vaccine? Are you going to get it? What's your thoughts on that?
On the COVID shot?
Yeah.
It's not for me.
Okay. Have you heard of any bad experiences?
I hear about it on the news.
Okay.
And I'm not the only one. Both of my older boys, they're not getting them.
They're not going to get it?
He's not going to get them for his kids, and his wife's not getting it. No.
Okay. Do you think it's not safe, or?
No, I'm just not getting it.
It's not going to do it?
Yep, it's not going to do it.
Okay, can you have them?
I know there's a wide spectrum of how we approach the vaccines. We're not quite sure why, but I'm sure there's trust issues.
So I don't know what the answer is to that, I mean, because you could talk yourself blue in the face and, try and get people to understand, and they still won't.
I'm definitely not doing the COVID shot. I'm not giving it to my kids, especially Heavenly, because of her immune system.
Is there certain concerns you just don't, you have?
Because I say we've survived Ebola, SARS, anthrax. These have been short-lived viruses. And then here comes this one that is just kicking doors down and just taking lives left and right. So to be precautious, yes. I had my mask on, but a 2-year-old kidnapped it. So tendencies to proceed with caution.
Yeah.
But as far as the vaccine, that's one thing that I stray away from, only because I've seen people already getting sick from it, even nurses and doctors.
But when you say that you've seen them sick, is it the same as COVID where you had
Yeah,
those?
I've seen one nurse, she got the vaccine, and she said that she was experiencing the shortness of breath, felt just really laggy, tired, and just lost the appetite. She started to feel depressed because she wasn't around her family. She was isolated. To see her go through that after getting the vaccine, and it's supposed to be something to help, I don't think I want to venture down that road.
What about her if she would have got COVID? Would it have been worse for her? Would she have?
I'm pretty sure it probably could have been a possibility, but to know that she was trying to protect herself from getting it and that was the outcome.
I'm on my Facebook and I see doctor died from COVID vaccine or nurse died from COVID vaccine. I don't really read into it just because it could be something else and it was a coincidence. A lot of it's just fake news.
Vaccine hesitancy has been an issue for the past maybe 2 or 3 decades, certainly in the United States.
And I don't think everybody who is refusing the COVID vaccine is refusing for the same reason. There's some big themes we know, but I think it's important to try to understand.
And I will bring this just in case there's some families that don't attend here. They can at least be informed. So I can help spread the word too. Elbow to that. Elbow to that. There we go. There you go, Mommy.
The biggest challenge for getting communities of color to get vaccinated is really the barrier of hesitation.
There is vaccine hesitancy or concerns which is circulating in the social media.
Given the way technology has become, people just cut and paste things, they create things and put out there to scare people.
Again, this is not just communities of color. They're concerned that vaccines have microchips and then the government's going to be tracking them.
Get microchipped with a vaccination.
Microchips?
A chip.
Chips. Bill Gates is somehow wanting to kill Africans by giving them the vaccine.
And then maybe that sounds crazy to you and I, but again, these are the fears that people have.
When you have that history, it doesn't sound silly to us. It doesn't feel silly to us. You know what I mean? It feels real. This may be really far-fetched, but I heard someone say that, they're injecting people with a strain of HIV.
They think that it's going to give them COVID.
It's COVID. You're giving me COVID.
They're testing it on us. I heard that the vaccine is not that safe.
There are videos about a lady who got the vaccine and then fainted, and that turned out to be nothing related to the vaccine specifically.
Are we getting a diluted version?
They're using current aborted babies to make the vaccine.
The vaccine will infiltrate your DNA and then you won't be able to have children and reduce your sperm.
So it will affect our fertility.
Is that true that alien substances are being used to develop the vaccine?
Messenger RNA is something that is going to be used to cause mutation.
That they will turn into a crocodile. They won't be a human anymore.
They've said if you take it, it's going to turn you into a zombie.
Don't become a zombie.
Oh, are you checking on me to make sure I've not become a zombie yet?
You got the vaccine, you never become a zombie. I was like, I would have been already a zombie.
All sorts of things that are, not true, but then again, they're being shared widely.
It's enough to make people that are reluctant, remain reluctant and resistant to moving forward taking the vaccine.
Those are kind of the fears and the concerns that we have to combat, and that's the role of public health professionals and health professionals like myself to really speak to the science and really speak to the safety and really speak to the protections for what we have going on here in the United States that hopefully have people's best interests in mind.
Not in a paternalistic way, not in an imposing way, but on a respectful way. We know that when patients and families do receive good quality in their language education, they do change their beliefs.
So I think that eventually they will get it, but I think that we just need to kind of work with them, to let them know that it is safe.